always introduce fiber supplements gradually with lots of water. You don't want to just blow it in too quickly. That can make the bloating worse. You wouldn't believe how many of my patients started fiber too quickly and then had even worse problems. Hey everyone, Dr. Partha Nandi. Thanks for joining me on this Tuesday afternoon. I'm talking about a common complaint for many of my patients, which is bloating, right? You feel like your stomach is a balloon, or you feel like you're pregnant and you shouldn't be. So I'm talking about that problem, and I want to give you my tips. So thank you for joining me today on this wonderful Tuesday afternoon. Please let us know where you're joining us from, and any questions you have, we'll be happy to answer them. Again, Dr. Partha Nandi talking to you about bloating. So let me just text some of the folks that so they know we're joining you. We're going live. So again, welcome, Dr. Partha Nandi here, talking about bloating and that feeling like you're uncomfortable and semi-pregnant. This happens to men and women, so it's a big problem. So many of my patients come and talk to me about this, and so we'd like to know, hey, you know what, what kind of problems do you have, and what tips that we give? So I'll tell you, how common is bloating? How common is it? 30% of U.S. adults experience bothersome bloating some of the time. For those who don't experience bloating, it may not seem like a big deal, right? However, it is a huge problem if you do. So it's like so many other problems that I speak to my patients about. If you don't have it, you think, hey, what's the big deal? But really, it can be an enormous deal that changes your life. So, what exactly is bloating, right? People say, what the heck does that mean? Because people use that. And bloating is a condition where kind of your abdomen, your belly feels full and tight, often due to gas. And you haven't had a Thanksgiving dinner and you still feel like that, right? So bloating, generally, we refer that to a sensation of pressure. And sometimes you can even see it. A lot of my patients bring in pictures, say, look at my abdomen or belly afterwards. Measurable distension in your abdomen, as if someone had a pump and filled your belly with it, right? And many of you, and you guys can tell me, hey, you know what, is this something that you guys experience, and what do you do about it? Happens, and it doesn't mean that because you're bloated, it's only for people who are obese. It can happen to the leanest of folks. I've seen people that are extremely fit and thin and they still have bloating, right? Remember, digestion can often be less than optimal because of our hectic lifestyles. Everybody's in the go. Go. We gotta go. And often, right, we consume food way too quickly. Often it's not cooked well enough. All those kinds of things. And bloating is an unpleasant feeling. So again, I talked about how common is bloating just in the U.S. Some of our listeners are not in the U.S., right? And Jeanette is from Switzerland. We're talking about just in the U.S. Worldwide, it could be even more. But 30% of U.S. adults have bothersome bloating, not just it comes, but enough that it bothers you, right? Amongst those with irritable bowel syndrome, up to 90%. Big deal. It's a big deal. And up to 75% of women experience bloating before and during their menstrual cycle. So that's every month we're talking about, right? Even if you don't have it besides those times, but it's still a period of time that you have to deal with. Roughly 50% of people who experience bloating talk about a distended abdomen. So lots of these facts. Now, what causes bloating, right? Again, I'm Dr. Partha Nandi, for those who are just joining us, talking about bloating. One of the biggest problems that so many of my patients have, and they come and talk to me about it because they're frustrated. First of all, a lot of people don't take you seriously when you're bloated, right? And you've got to be able to talk to your doctor. So I'm telling you, it is a bothersome problem that can affect your life. So what about some causes? Common cause of stomach pain and bloating is excessive intestinal gas, right? If you get an abdominal bloating, if you have bloating after eating, it may be something with digestion. You're not digesting your food properly. And I'll talk more about that as we go on. Gases in your intestine are mostly produced, right, by gut bacteria digesting foods, often carbohydrates. something called fermentation. They release gas. They eat this stuff, they release gas, and there's too much of this going on, fermentation. It may be because of too many carbs. So we talk about eating complex carbohydrates, not eating simple sugars, because it can produce more gas. And these were not naturally absorbed earlier in your GI tract, in your digestive process, and then they get to the gut bacteria, and then they eat it up. I eat those carbohydrates up. It might be as simple as, you know what, eating too much, too fast. A lot of us do that, right? We're in the car with your giant sandwich, and you can have also food intolerance where you're not digesting your food properly. So another common cause can be from your bowel movements, right? Are you constipated? So many of us are also constipated. If the longer your stool stays in your colon, the more time the bacteria have to ferment, and you could also cause more gas and bloating that way. Also, physically, you can back things up and have physical distension if you have too much stool in your colon. Symptoms of constipation includes what? Straining to start or finish a bowel movement. Very important. Stool that looks like rocks and pebbles, and we've talked about the Bristol scale of looking at stool and understanding what is normal and what's not, right? Stool that looks like rocks and pebbles, not good. Not feeling empty after a bowel movement, feeling like you're not, I'll use the word satisfied. You're not quite satisfied after you have a bowel movement. All those things signify constipation. So other causes of bloating is what? Gut sensitivity. People with irritable bowel syndrome, IBS that is, can be very sensitive to gas, right, which causes pain and cramping and diarrhea. And you can also have something called SIBO, SIBO, also known as small intestinal bacterial overgrowth. Most healthy people have relatively few bugs in the small intestine. But those who've had, for example, intestinal surgery, reasons why your small intestine is altered, can have SIBO, which can then cause bloating. Why? Because you have a bunch of bugs in the small intestine eating up all the foods, and then can cause this bloating with fermentation we talked about. What about gastroparesis? It's a fancy word that says, hey, your gut is not moving the food through your stomach well enough. That can cause bloating, that can cause nausea, and even bowel blockage. A lot of diabetics, any of the people that are listening, diabetic, that could also cause it. Gynecologic conditions, also women's menstrual cycles, common cause of temporary bloating. Sometimes problems with ovaries or uterus can also be causing bloating. And it can be some serious medical conditions, right? You could have bowel obstruction, things like liver disease and types of cancer. We worry about colon cancer, pancreatic cancer, stomach cancer, mesenteric cancer. All of these can really work to be able to make this happen, right? And so important to know that. Tell your doctor if you're bloated, especially if the bloating is something that's happened that's new. Very important. Now, what about some help? What relieves bloating, right? Lots of things that are out there that are natural. First of all, you should go to your doctor, make sure there's nothing serious going on, right? You got to get an evaluation, make sure there's not a malignancy or something really serious before you go down the path of using natural remedies. So what about herbal teas? Peppermints, chamomile, ginger, all have been really used for many, many hundreds of years, right? Turmeric, fennel can aid in digestion, and help process the gas. Now, peppermint oil capsules, natural antispasmodic. If you didn't, maybe you didn't know that. So peppermint oil capsules can decrease the spasm, decrease the pain, decrease some of the discomfort, right? And what happens is that the antispasmodic relaxes your intestinal muscles. And when you relax your intestinal muscles, that decreases some of the pain and the feeling of this bloating. Can help you pass trapped gas, trapped stool, especially if your problems come from a movement problem, that the intestine's not moving properly. Antacids have been shown to relieve inflammation in the digestive tract and help also help pass gas more easily. So again, for those just joining us, Dr. Partha Nandi talking to you about, gas and bloating and what is all that about? How can we be helped by that? If you think this is useful, please share this with your community. We also talk about psyllium, right? Fiber Husk, popular fiber supplement that can help you defecate, go to the bathroom more regularly also helps. Always introduce fiber supplements gradually with lots of water. You don't want to just blow it in too quickly. That can make the bloating worse. You wouldn't believe how many of my patients started fiber too quickly and then had even worse problems. Abdominal massage can sometimes help to help the symptoms. Magnesium supplements, that's an important one, can also help neutralize some of the stomach acid and help to relax some of the intestinal muscles. Magnesium has a natural laxative effect. Also, it can be helpful from time to time, but you don't want to use it all the time without talking to your doctor. Very important. Probiotics, right? We talk about probiotics all the time, along with prebiotics, but probiotics are the good bugs in your intestinal system, right? Probiotics can help you to digest your food better and may actually help you sometimes to reduce the amount of gas that's there. So super important. Digestive enzymes. So naturally occurring digestive enzymes are very important. They're proteins that your body makes, right? To be able to break down food and then help in digestion. Super important because your body, for example, your pancreas makes enzymes that digest foods. They make amylase, they make lipase, right? They make these enzymes that help you to digest the food. So digestive enzymes are critical. If you don't have them, you're not going to break down the food properly. You're not going to absorb the food properly. So critical to have the right amount of digestive enzymes. Those of you just joining us, Dr. Partha Nandi talking to you about a big problem that many of my patients have, which is what? Bloating, discomfort, and what can cause it. And we've talked about, 30% of U.S. adults suffer from it. Huge problem, right? And what can cause it? And we talked about most common cause is of this bloating can be intestinal gas produced by the bugs in your intestine. So it also could be a digestive issue. So now we're talking about, hey, digestive enzymes, because we hear about that all the time. Stomach, small intestine, pancreas all make these digestive enzymes. Super important. They're non-living proteins, like I talked about, that speed up the chemical reactions, help to break down the foods to its elemental products so it can be absorbed, so you can use it, right? Some people don't have enough digestive enzymes, or their bodies don't release the enzymes like they should, and that causes problems. So they can't break down certain foods. And then very importantly, they can't absorb nutrients. So not only are you not feeling good, you're not getting the benefits of the nutrients that are there. So that's critical. Sometimes medications, right, can cause this issue. So when you have, for example, depletion of stomach acid due to medications and age also can be a contributing factor. They're further compounded, right? You make less of the enzymes as you age, and then when you have certain enzymes, certain medicines, they can interact with it. That leads to what? Suboptimal nutritional status, especially with certain vitamins and minerals. And then insufficient or not enough enzyme activation in your stomach. So you need to activate the enzymes in your stomach, and you need a certain type of environment. If you are depleting all the acid, or you're changing the normal content of your stomach or your intestine, that changes everything. So very important. Benefit of digestive enzymes are that they can help you break down food if your body is not being able to do that. So you can experience less gas, less bloating, less burping. You may actually notice that your stomach feels a little lighter, emptier, right? Like your food is actually moving through rather than just sitting there stagnant. Very, very important. Now, digestive enzymes also can help improve food tolerances, meaning that if you're intolerant to certain foods, right? Not food allergies, but food intolerances, meaning that you don't develop a reaction to it, but when you eat it, you don't feel good. You don't feel like you've digested food. You feel bloated, uncomfortable, right? So digestive enzymes can really help with that. And studies show that supplementing with enzymes can especially be beneficial. For example, people who have lactose intolerance. Many of you who are listening may have had lactose intolerance or have family members that do. Or you may have pancreatic enzyme needs. A lot of people that have had benefits when you replace those. There's also some preliminary research that a digestive enzyme called ANPEP can also help improve symptoms of gluten sensitivity. Think of how many people out there would benefit from that, because gluten sensitivity, right, can be so critical in not being able to be able to eat foods properly and not feel good. With gluten sensitivity, you can have bloating, abdominal pain, change in bowel habits, and it's vastly underdiagnosed. So if you have some of these symptoms, talk to your doctor and say, hey, could I have gluten intolerance? Do I need digestive enzymes? Could I have these issues? Instead of just saying, well, you got to live with it. I'm here to say you don't have to live with it. Talk to your doctor, talk to your healthcare provider, and we can help as well. And so, we're going to be making, and I've told you for the last couple of weeks, I think, that we're going to start our own brand of supplements, because you often have missing needs. When people ask me, hey, can you recommend something? Sometimes it's missing. So we're going to make our own line of digestive enzymes, comprehensive blend. It's going to be acid resistant, plant based, which is important, right? You want to make it plant based and as wholesome as you can. These are enzymes that'll help to maximize digestion and absorption of nutrients from food. You want to be able to get the value from food when you're eating it. Now, these enzymes are designed to help folks who have, we believe that a plant-based diet is a good one. Doesn't mean you can never have meat, but I think a plant-based diet in general is healthier, right? So it's designed to enhance the benefits of the plant-rich diet, the digestive enzyme that we'll be releasing. It stimulates the release and production of natural digestive enzymes of the pancreas. Remember, I talked to you about amylase and lipase that are secreted by the pancreas. Helps to digest your food, especially the fats, proteins that you have. Also helps to change the balance of gastric acid. That's the stomach acid that's produced. Helps to support the gastric acid balance, and then also it enhances your digestive functions. And what you want to do is we want to be able to target the enzymes for food sensitivities. Now, we're not talking about food allergies, but food sensitivity. And we'll have, in each capsule, we'll have lipase, amylase, lactase, and protease to be able to aid in the digestion of all your components. But if you talk to my sons and tell them, hey, what are the components of food? They'll tell you, and Sean and Partha will tell you, protein, fat, right, carbohydrates, and also sometimes also fiber. You want to be able to tolerate fiber. So we also are really embarking on giving you cercoilase, which is a special blend of hemicellulose and it's beta glucanase and phytase, all these special names specifically formulated to digest the cell walls of plants. Because if you're promoting a plant-based diet, right, and you can't tolerate it, that doesn't work. So we'll also have a bitter herb as well as artichoke to be able to aid in the body's natural production of enzymes and bile. I'm excited because if you can enhance your body's natural production of bile and be able to digest foods, it's going to be fantastic. So I'll tell you, I'm excited because this is such a huge problem for so many of my patients and so many people in general. When I talk about a quarter of the population suffering in the US from that, internationally, it's also going to be the same. So I'll tell you some tips on how to prevent bloating. We talked about digestive enzymes. Typically, the first line of defense, first line of treatment for preventing gas and bloating is changing your diet, right? Research, and we love to be able to give you research-driven tools, right? Research has shown, and many of you have heard about this, that a low FODMAP diet, what does that mean in English? So low fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So these are the carbohydrates, right? That the bacteria and your body's not absorbing and not digesting it properly. So you want low fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So it's FODMAP is the acronym for that. And that low FODMAP diet can really help you decrease the symptoms of bloating and gas. Very important. And we will give you examples of a low fat FODMAP diet. If you'd like, just please connect with us on Facebook. And again, please share this with some of your community if you think this is useful information. A low FODMAP diet avoids fermentable, right, things that produce gas, avoids fermentable gas producing food ingredients. And examples of oligosaccharides are found in wheat, onions, garlic, legumes, and beans, right? So we eat dal, legumes, which is so the idea of our Indian brethren, people who are from the Indian subcontinent eat dal all the time. It's going to be issues, right? So you want to avoid oligosaccharides in the low FODMAP diet. Wheat, onions, garlic, legumes, and meats. Disaccharides such as lactose in milk, in yogurt, and in ice cream. Nobody wants to avoid ice cream, but you got to in this one. Monosaccharides include fructose, which is a type of sugar, and it's found in fruits and honey. So remember, monosaccharides. You can also find it in apples and pears. So monosaccharides are another one. And polyols are sugar alcohols found in things like apricots, nectarines, plums, and cauliflower. One of my favorites, cauliflower. So you have to avoid that with this diet, as well as many chewing gum stuff. People chew gum all the time. Polyols or sugar alcohols are in those chewing gums and often candies. So people who are sensitive to FODMAP-rich foods, right? The small intestine doesn't always fully absorb these carbohydrates. And instead, what happens is that they pass it to the colon. Guess what happens to the colon? It's a party, right? The bacteria, the trillions of bugs there, they're like, it's celebration time. And they ferment it, right? They produce the gas and you're miserable. To see if some of the low FODMAP, diet and your FODMAP foods are causing gas, you can start by cutting out FODMAP foods and then slowly bringing them back into your diet one at a time, not like all at once because you don't know what's going on. Again, Dr. Partha Nandi, for those of you who are joining us, talking to you about bloating, right? Bloating, constipation, discomfort, gas. It's a problem so many of us suffer from, and we're not getting solutions. So I wanted to talk about it, give you our tips and what can cause it. We're talking about over a quarter of the population suffer from it. Now we'll keep going here. Fiber. Now, when you want to talk about fiber, you want to increase it gradually because eating more fiber helps to prevent constipation and bloating. But you got to go gradual. Can't just go crazy overboard immediately, right? Most people in America, we know from research, only don't get enough fiber, right? And remember, only 5%. That is 5%, which means 95% of people are not getting the fiber they need, which is recommended, 25 grams for women, 38 grams for males. So you can put that, if you are eating 3 balanced meals and you can divide that number by 3, you should be getting that. Very few people are. 25 grams for women, 38 grams for males. Super important to bear in mind that eating too much fiber or increasing fiber intake too quickly can cause even more gas and bloating. People may notice that adverse events from eating more than 70 grams of fiber. So you shouldn't, like anything else, too much of a good thing is not always great, right? Whenever increasing your fiber intake, remember, start slowly and then increase the intake over several weeks. Let your body accommodate to it, right? And then I would skip all the fizzy stuff, which is, in Michigan, we call it pop. You can call it a soda. So all the stuff that has carbonation, please avoid the fizzy carbonated drinks that can build up in the stomach. The carbon dioxide that makes all of these beverages, basically can cause the bubbling and stomach bloating and discomfort. Remember, sugars or even artificial sweeteners, you're trying to, say, I'm going to have a diet this or diet that, can also cause gas and bloating. So some of my patients, when they come and see me and they have gas, I tell them, do you use artificial sweeteners? And if they do, we really recommend they cut it out. So super important because it's not being absorbed, right? So it can also cause the gas and bloating. Here's a big one. Drink enough water. Folks don't drink enough water. They're drinking all kinds of other things, but they're not drinking water. Very important to drink water. The other part, we talk about it, being a health hero, get active every single day. Exercise helps your body move the blood, move the stool, move the gas out of your colon. So if you're sitting in your body all day long and just, you're getting a DoorDash or somebody else to bring everything to you and you're not moving at all, get out there and move. It's going to make a big difference, right? Exercise also releases extra sodium from the body through swelling, help to relieve some of the water retention. Talking about getting bloated. It can also help prevent the rapid water gain that often, the rapid weight gain rather, can help you reduce the rapid weight gain that can often go straight to your belly. Avoid processed foods. Also, processed foods low in fiber, high in fat, high in simple sugars. If you avoid that, that'll be a critical part of this. And then remember, try to not have excessive salt, cause water retention. And fat, what does that do? Slows down the digestive process because it's taking a long time to digest the food. All these things can lead to constipation, lead to bloating, which is what you want to avoid. Remember, also processed foods, low in nutrition. So you're not even absorbing enough of the good stuff to be able to help you to feel like you've had enough nutrition. So it helps you feeling hungrier. Even after you get a lot of calories, even though you have a lot of calories, low in nutrition. And then you're eating more and it just continues on and on. So important. Again, Dr. Partha Nandi talking about bloating. A lot of people have it. Very, very common problem in our population. And when should you be worried? Right? A lot of people have bloating. This, I know a lot of people that have bloating. Who cares, right? Here's when you should care. Here's when this is important. You should be worried about bloating. Most stomach bloating will resolve on its own. However, you should see a doctor if it does not go away, if it's persistent, or if you notice any of the following symptoms or problems. Number one, any blood in your stool. Persistent abdominal pain, especially if it's severe. Diarrhea, chest pain, sudden changes in your weight, especially weight loss, change in your stool color, change in the consistency of your stool and the frequency of your stool, unexplained being too full too quickly, right? Or loss of appetite. Super important to know that. And then if it's progressively getting worse, it's not only is it not just there for a little while, but it's getting worse. Very important. And especially if it persists for more than a week, persistently painful. Or if you just are worried about it, see your doctor, don't blow it off. There are lots of solutions, but you want to make sure nothing serious is going on so you're not ignoring it or blowing it off. Super important. So remember, if you're having bloating, doesn't mean that you're the only one. Lots of folks have bloating, and in fact, a big portion of the population experience bloating at some point. Remember, if mild constipation is a problem, a fiber-rich diet, water, exercise can help, but these steps don't always work for conditions like irritable bowel syndrome with constipation or chronic constipation. Chronic constipation or other conditions such as gastroparesis may require medical treatment. So it's important to talk to your doctor really about bloating symptoms. Simple lifestyle changes can be very, very helpful to prevent from recurring. And supplements, we're developing a line, can be very helpful. When it comes to digestive enzymes, most useful for people who aren't producing enough or adequate amounts of enzymes, and their environment in their stomach with acid is not appropriate. So, when we talk about the supplements, we're going to give supplements that have lipase, amylase, lactase, and then protease to be able to help digestion of protein, fat, starches, and fiber as well. So excellent stuff. I'm glad all of you joined us. And please, again, share this with your community. Let me say a quick hi to some folks. Christine Sutherland, always so lovely to see you on from Port St. Lucie, Florida. And Stella Hariprasad, and then Jeanette from Switzerland, Angel from Kenya, Josephine also. And Josephine had a question or a comment. I have diverticulitis, and my doctor said to try to get to slowly so food doesn't get caught in the small pockets of the intestine. I think more importantly, Josephine, it's important to have a high fiber diet, and make sure that you have plenty of water. You always want to eat slowly, but it's more important to have more fiber and water. Uloma viewing us from Nigeria, welcome. Faye Rogers, one of my favorite people on the planet, thank you for joining us from Troy. And then Christine says, I boil ginger, cinnamon sticks, lemon with a tinge of black pepper and sweetened with honey. It helps me with digestion, helps me with AIC. Excellent suggestion. Thank you. I love those suggestions. And then Juliet, watching from Jamaica, man. Excellent. Thank you for joining us. Chantal and Tim Chisholm, wonderful to see you guys from Northern Michigan. Just got back from Northern Michigan. Beautiful place. If you haven't visited the UP in Northern Michigan, if you're not from Michigan, please take the time to do so. Josephine Hertel, thank you for joining us. Karen is from Hazel Park, and taking enzyme supplements seems to have helped a lot. And here's an example. Karen suffered from a lot of bloating, and her enzymes helped her to feel a lot better. So I appreciate you sharing that. And then Josephine says she also suffers, she can't have lactose producing substances. And Christine said she had rice dal and curry shrimp with and mango amchar. And as long as you don't have to be on a low FODMAP diet, that's perfect. But you may have to, not have the dal as much if you have a low FODMAP diet. And then Vicky McDonald, thank you for joining us. And Juliet, oh good, thank you. Juliet says I'm learning a lot here. Please share this with your community, Juliet, if you can. And Jolene from Gulfport, Mississippi, thank you for joining us. Appreciate it. And listen, all of you, I'll be back again next Tuesday around 5:30 to talk about more, stuff that's really important for us, and I'd like to be able to share with you. So remember, make healthy living part of every day. If you have any topics you want to suggest that we talk about, let us know. Enjoy your evenings. Thank you so much. Hi, everyone. I'm Dr. Partha Nandi. And if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.